Hi, my name is Eric Kazanjian, and I'm a fourth year medical student at the Quinnipiac University Frank Netter School of Medicine. In this video series, I'll be interviewing individuals who have been diagnosed with Alzheimer's, as well as their caregivers on what it's like to live with this disease and how their lives have changed because of it. The purpose of these videos is to give these individuals a platform to make their voices heard, to educate the public, and to reduce stigma surrounding Alzheimer's. I've also interviewed two healthcare professionals to get their unique perspectives on the challenges of caring for those living with this disease. And lastly, I've included some resources on the channel, which I hope may be helpful if you, a family member, or a friend has been diagnosed with Alzheimer's. Thanks for watching, and I hope you enjoy.
My name is Mike O'Connell. This is my wife, Toni O'Connell. We're married since 2001. Been together a total of 21 years together. For some time, I have been noticing changes with Toni that were just seemed out of the ordinary. Just her forgetting whole conversations that we had had. Possibly like 5 to 7 days earlier to that, and having no recollection of certain events, started to concern me, and just little oddities here and there, not being able to find something all of a sudden, when she's looking in the right spot, but doesn't look around enough to find it, totally out of character for her.
I knew there was something going on, and
Toni was the one that actually reached out to the Alzheimer's Association for herself.
Yeah.
As far as the doctors, they didn't really have a lot of suggestions for help, where to seek help. The Alzheimer's Association has been our main source of information for help. And we've gotten a lot through them. But there isn't a lot of, other than that, there isn't a lot of community information out there, different resources. You kind of have to, either they know about it or you have to find it yourself.
Can you talk about a little bit more about what the Alzheimer's Connecticut or the Alzheimer's Association provided you in terms of resources?
They've helped us, with finding legal resources. They provide a group for caregivers and for those who have the disease. They've also helped us, pointing us in the right direction, where to find clinical trials. We work with them, for community outreach and, different events.
If you could describe a little bit how having Alzheimer's has affected you in your daily life. So I guess both of you could touch upon this a little bit.
it's difficult. I still do my normal things and stuff. uh,
I think one of the biggest changes more recently has been the changes to the activities of daily living. There's been a marked increase in those abilities, and as well as the ability to perform consecutive commands. There's just a lot of struggle there. As far as being able to, do daily stuff. I mean, there is a certain amount of daily stuff that you could still do, but it some are more difficult than others. It's definitely more the mental abilities to follow a process that normally think about when you're doing something, such as heating up a meal. Nobody really thinks about 12 steps that go into heating up a meal, you know, but there's usually a lot in there.
Mhm. Thanks for that example. Do you have any other examples maybe of how the cognitive function has affected some of those, aspects that people wouldn't really normally think of?
Using technology, even simple technology, um, using a telephone, uh, you know, um, just a television, you know, little things like that that most of us take for granted and don't even really think about. Um, you know, even in situations where we could, um, if we don't understand something, we can figure out how to do it just by looking for instructions or working it out. There's no working it out. It's either you can or you can't. We both try and go through uh, this journey together, um, trying to have fun, trying to make light of whatever we can, joking about it. Um, there's you know learned to come at it from the perspective there's no need to get angry over it, just laugh about it, and that helps us a lot. We you know we enjoy spending time together now. We do a lot together. You know, it's it's all about enjoying the time that we have.
I said, it just sucks, but there's nothing you could do. We've done a lot with the Alzheimer's people. They're wonderful.
You guys have touched upon this already, but are there aspects of your personality that you say that you would say have changed?
I laugh a lot. I try to. We just try to do a lot of funny things, and I don't know, just
I know that one thing, we do laugh a lot, and we do enjoy a lot of positivity. But unfortunately, one of the things that disease has done is it's exacerbated some of the negative aspects of of personality. Like it unfortunately it's given her a sometimes increased sense of anxiety over certain things. Um, Timing, being being somewhere, just you know, fretting about something that might be coming up. I know one thing that uh, it it's been a big personal growth for myself. Um, Seeing what's happening to Toni has allowed me to look at uh, other people, out there and uh, wonder, what, not the looking at it through the lens of when they're not understanding something or they're not getting whatever it is or just whatever is going on when I'm interacting with somebody, to think about what's going on with them. Why are they struggling to understand what I believe is a simple concept? We often, just, you know, think that the world knows what our expectations are, and not understanding of, what this other individual is, going through. I've seen it a lot with, other people where they look at her and treat her differently because they're not understanding why this young looking person isn't understanding, the simple thing they're trying to tell them. I know it's made Toni very stronger, because she's had to learn to adapt to, how things are constantly changing for her, and how she's going to, deal with, the new problem that arises. It's like learning in reverse. I know that looking back, I know there was a period of denial for her. I think most of us, when faced with something like that, don't want to acknowledge what's happening. And I think that, I know because
I was the one that went to the hospital for special.
yes, she went to her the psychologist that she was seeing at the time, and began complaining about these things, and that she was the one that eventually said, well, maybe we should pursue something further or something different. And that's where the testing got initiated from. But Toni was the one that was pushing her to say, hey, something's not right.
I knew.
And I need to do, figure what's really going on here.
Because I was a nurse, I knew something.
Is there anything else that you would like to add?
Show me your tattoo. She got this tattoo. I don't know if you can. I
can see that now. Yeah.
She got that one shortly after being diagnosed, and it says "Live without fear." It's just kind of the mantra that she adopted after her diagnosis. Because you can't go backwards, you can only go forwards.